Hello, and thank you for joining our webinar on adapting employee healthcare benefits to current times for optimal results. I'm Reagan Corliss, and I'm an Assistant Director of Marketing for Journey and MedSavvy. So real quick, if you'd like to receive your HRCI or SHRM credit, just contact us at this email, marketing@medsavvy.com. Also, you're welcome to submit questions and feedback. Just use the contact link below this video. So this presentation revolves around redefining the healthcare journey. We'll cover the latest research and trends, plus how employers should adjust their healthcare benefits and well-being objectives accordingly. We'll also cover employer and employee real-life case studies and current trends, including virtual programs and consultations that are being implemented during COVID. And lastly, we'll discuss the new normal for the healthcare consumer. So what do we mean by redefining the healthcare journey? Well, now more than ever, employee health and well-being programs need to be effective, not only in improving employee health, but also in providing ROI and VOI, which represents the value on investment, in case you're not familiar with that term. Additionally, the pandemic has shown us that easy access to care, personalized support, and online health solutions are imperative to not only overcome today's health crisis, but to the future of how people engage with their health. New and innovative online services tied with personalized care are redefining the healthcare journey. However, while health technology is gaining ground, the need for personalized support remains stronger than ever. So, in this presentation, we address key areas in delivering employee healthcare benefits for optimal results. Starting with well-being. We all know that your health plan costs are incurred by a small percentage of your employees. Balancing the human touch component with technology allows us to better reach those higher risk employees to prevent their health issues from escalating, whether we're targeting an entire member base or member population, or homing in on the highest risk individuals. And of course, the benefits are increasing productivity and retention while decreasing absenteeism. Well-being programs are an important component not to be underestimated, and there has been an even deeper need for employee wellness programs during these COVID times. We'll cover the effect of COVID on well-being programs, plus how you can provide the VOI and evaluate the value of your well-being programs as drivers of better health outcomes. Next, we're discussing costs. Saving on increasing healthcare costs has already been challenging, and now COVID times are making cost saving all the more important. We're going to look at one of the areas with the highest potential for savings, your pharmacy spend. And lastly, the third component is your employees' health care experience and the increasing demand on HR it entails, as well as an extreme lack of ease for your employees to take advantage of the benefits you're offering. We're going to talk about empowering your employees to experience healthcare in new ways, plus how the industry is addressing the unmet needs. So real quick, I'll list our presenters, and then I'll go into a little bit more detail about each one before they speak. We have Catherine Lau, who specializes in analytics and research. And then we have Megan Boyd, who specializes in account management for wellness programs or well-being programs. And then we have Jeff Fitzpatrick, who focuses on the more technical side of well-being programs. We have myself, and I am focusing on the RX costs, the pharmacy spend, and representing MedSavvy. And then we have Kristen Walton, who is representing Journey, and she will go into the employee experience side of things. We're all tied together by Cambia Health Solutions, which is headquartered in Portland, Oregon. Cambia is a total health solutions company that is deeply rooted in a 100-year legacy of transforming the industry and the way people experience healthcare. We're committed to delivering a seamless, personalized healthcare experience for the next 100 years. So now moving on to our first presentation section, it is going to cover the market research, insights, and trends, which have been gathered from a Cambia survey that basically takes the latest pulse of the employers and HR execs. And then also she's going to cover COVID-19 impact on mobile health. So basically, again, this is covering the latest research and trends, plus how employers should adjust their healthcare benefits and wellness objectives accordingly. So this is presented by Catherine Lau. She's a senior research analyst in product marketing for Cambia Health Solutions. Catherine works with the Cambia product marketing team as a senior market opportunity analyst. She provides market research to the Cambia product team, both primary research as well as market trends, competitive intelligence, and market opportunity strategy and analysis. Catherine has a long history of working in market research for healthcare and technology companies. So now, Catherine, I'm going to hand it over to you.
Great, thanks, Reagan. So one of the first things I'd like to cover is we've been doing a pulse survey. Cambia conducted a pulse survey with employers at the start of the lockdowns in May due to COVID-19. And we've done several waves since then, from May to July. And some of the key takeaways that we heard from employers, sentiments and trends that they're dealing with during COVID cover areas around benefits and how they're rethinking how the needs of their employees. So one of the first things that they've been telling us is they've been expanding and changing current healthcare plan offerings. They've continued to increase those offerings, but it is a secondary priority to establishing workplace safety protocols, as you can imagine. The negative feelings about the economy persist. This is in line with the uptick in COVID-19 cases and the potential of businesses needing to remain closed. Overall, there's still optimism for the future, but this feels very disconnected from how people are feeling currently about the economy. So they're looking to the future and they're hopeful that things will get better, but right now they're still worried about the economy. They're also modifying plans such as more benefit options, wellness, behavioral health, in addition to looking for good value and more payment resources. They've also increased the importance and closed the gap with telehealth as a primary need during COVID-19. So one of the first slides I have here is the current economic outlook, as I mentioned before. So they've remained positive in terms of the economic sentiment, but it's been kind of gradually going down. So as you see there in the pink bar, you can see that significantly more employers were feeling very bad about the economy in July. And the bar in green are those feeling very positive, good, or very good about the economy. So you can see that it's the green bar has gone down and the pink bar has gone up over time. However, employers continue to express a positive economic outlook on the future, with a reported 70% feeling positive. The West region tends to be a little bit more pessimistic than the South. And in wave 6 of our survey, it coincided with the reclosures impacting the West, and rising rates in the Midwest may have similar impacts moving forward. On the next slide, we look at the companies that are continuing to change their healthcare offerings. So 65% of companies report a change to healthcare plans. As you can see, the gold and green lines in the chart indicate the trend of employers making changes to those health plans. 35% of companies changed healthcare plans, a significant increase wave over wave. Again, there's differences by region, so the West Coast is more likely to have made adjustments in response to COVID-19, and the Midwest hadn't been making changes as of July when we finished taking the survey. This may have changed now that there's surging in COVID in those areas. On our next slide, the employers are really prioritizing workplace infrastructure and employee benefits. Maintaining new ways of working and employee benefits are definitely a priority. In line with waves 1 through 5 of our survey, 73% of employers prioritize employee benefits and health wave over wave. The gray bar you can see on the chart here indicates the improving workplace safety is the #1 thing on their agenda. And that's been consistent wave over wave. On the next slide, we look at some of the specific things that employers are looking at. So when we asked, what are the options they're looking at, considering for their organization, telehealth ranks highest, followed by wellness and billing as key offerings. Telehealth is consistently top priority for employers, which is consistent with our own research that we've been doing at Cambia, followed by wellness and behavioral health options for employees, then financing, billing, and payment resources for employees. And then employee access to physician networks has increased in importance over time. If you look at the chart, I know there's a lot of lines there. The top blue line indicates the importance of telehealth, followed by the green, which indicates the importance of wellness and behavioral health. So that was looking at some of the research that we've been collecting on how employers are dealing with COVID. I'm also been tracking some other information that's out there. The company you may have heard, App Annie, they do a ton of research tracking mobile app trends, and they came out with some studies related to mobile behaviors during COVID that are relevant to the healthcare industry. So one of the big trends they're seeing is that is around telehealth. So as healthcare providers make their services more accessible, there's been a significant growth in downloads for popular platforms, including telehealth by companies like Simple Practice, Helo, Doctor on Demand, and Doximity. Teladoc reported a 50% increase in daily virtual medical visits in early March within the United States. Amwell told App Annie patient visit volume nationally in the US has been up anywhere from 100 to 300% compared to the expected number of visits based on historical patterns. Amwell also reports that the growth in the use of telehealth is correlated with the movement and impact of the virus. So this is really indicative of what employers are looking for with the telehealth for their employees. It's definitely something that'll continue to grow as the pandemic continues. So the other takeaway there is that 59% of consumers reported that they are more likely to use telehealth services during and due to the ongoing pandemic. And telehealth in general is playing an elevated role in the ongoing pandemic, and its adoption by both patients and healthcare professionals is expected to continue to grow, as you can imagine. The other thing that App Annie looked at was specific types of apps that have been on the rise in use. So they looked at hours spent in medical and health and fitness apps. And this is indicative of just the increase in need of these types of services. So consumers set a new record for at-home fitness and wellness at 113 million hours worldwide, just the first real week of lockdown, March 22nd through 28th, which is an increase in time spent in these apps in the beginning of the shelter-in-place policies. As work from home and social isolation policies are put in place, consumers are turning to mobile to find peace of mind and manage stress. So apps like Headspace, which is a meditation and mindfulness app, has seen a 90% increase in time spent on iPhones in the US during the week of March 1st over that whole week. The Mayo Clinic app on Android phones also has seen a dramatic increase, 200% of time spent on their app. The app provides users access to appointment scheduling, secure messaging with healthcare professionals, information on symptoms and diseases, and viewing test results. So globally, App Annie is able to look across what's happening with medical apps during the COVID-19 pandemic. There's been an acceleration of 65% in downloads among global medical apps in April compared to January of 2020. This points to an increased reliance and escalation of consumers' trust in these apps for handling tasks traditionally fulfilled in person when they go to the doctor amidst continued social distancing precautions as they, they try to stay safe and they're not always going to the doctor for every little thing. They're using apps to help them make those decisions. So that concludes the research portion of how employers are dealing with COVID right now. And I'll turn it back to Reagan.
Thank you, Catherine. That research was very insightful and relatable to the next set of presentations. Firstly, we're going to talk about employee well-being and resilience during COVID times. Megan Boyd will be our presenter. She is a client success manager with Canby Health Solutions Human Performance and Wellbeing Division. In this role, she partners with employers and brokers in the strategic development, implementation, and ongoing evaluation of health and well-being programs. Megan has spent the last 10 years in the corporate well-being industry servicing clients of various sizes, demographics, cultures, and industries. And what's really awesome is that she has a BA in psychology and a master's in organizational psychology. So as you can imagine, this is really relevant to her position in employee well-being. So now I'll hand it over to you, Megan.
Thank you so much, Reagan, and thank you all for having me today. I'm going to kick off today with a game. So if you could pick one emoji to describe 2020, what would you choose? Maybe this guy? Definitely been there. Little masky face. Or for coping, maybe some wine. Well, I personally can identify with each and every one of these emojis, and then some when thinking about 2020. There's another one that I like to think of as well, and that's this. The fact here is that 2020 has been a hard year for all of us. We've all been challenged, whether it's emotionally, professionally, with move to remote work or no work, personally with our own families, or even now with the double time that many of us find ourselves in as working parents. And while it has been a challenging year, it has also been a year full of adaptation, of resilience, of trial and error, and scrappiness. And so for our time today, I'm going to focus on the topic of resilience. So what is resilience? There are a lot of definitions out there, but these two from Merriam-Webster's dictionary are my favorites. To be resilient is to be able to become strong, healthy, or successful again after something bad happens, or to be able to return to an original shape after being pulled, stretched, pressed, bent, and more. I don't know about you, but the second one sure sounds like 2020 to me, and something that we've all had to practice as we've bobbed through the sea of 2020 challenges, from the COVID-19 outbreak to lockdown to remote work to trying to make decisions on when to come back from remote work, and so much more. We have all adapted and changed shape this year. And while it's been challenging, there could be a silver lining here. Something good can always come out of a bad situation. And so let's focus just for a few minutes on some possible positives to come out of this year. So let's ask ourselves a couple of questions. Have we learned something new this year? Maybe. Have you or your employees developed new skills this year? Have you learned something new about what works or doesn't work for your population this year? Have you perhaps put in place a new benefit that has been valuable for your employees this year? Can you finally answer that question that you've been curious about for a while? Can we actually excel or thrive in a remote work environment for the type of work that we do? In my particular role, as Reagan mentioned, I focus on client success in the corporate well-being space. And I can tell you that this year has wreaked havoc on full year plans that we had developed in partnership with our clients. But it's also provided us with a unique opportunity to learn something new and gain new learnings that we wouldn't have otherwise known. And so we've also, in addition, we've seen this with some of our clients, and I'd like to share a couple of examples with you today. So this is a particular employer that we work with. This employer profile has about 4,500 employees spread across multiple states and multiple physical office locations. Pre-COVID, there was about a 20% remote work environment. And so we've learned a couple things from this employer this year. And so some key learnings that we've had is just how valuable video conferencing can be to bring together the population. With strong either mandates or encouragement from senior leaders in place, we've seen that the populations really come together, and that's not just office employees with office employees, but it's office with those remote employees before. And it's really started to forge some very strong bonds and partnership. In addition, 2020 has been pretty unique in that our human resources partners have seen such a strong interest in individuals wanting to know more about their benefits. And while benefits have always been a part of compensation plans, employees this year increasingly are leaning in to learn more. And so not only are they providing positive reinforcement for what's there, but employees have also felt that they have a new voice in being able to highlight what's not there. And in this particular employer's case, employees had expressed more interest in more mindfulness support as well as self-care support. And so this particular employer actually listened to the employees and brought in a new vendor partner to be able to address this specific topic. And so that was a unique opportunity that was presented just this year. Something else that we learned with this particular employer is that they have multiple locations, as I mentioned, and they have physical exercise space and classes that were held every day across those locations. With COVID and the entire population moving into remote work, the Wellbeing team really needed to adapt here. And so they moved the exercise classes to be remote. They also added in health and well-being webinars as well to be able to reach the population. And in a discussion with the employer recently, this is something that they're going to continue to do. And the reason being is that they have just received the best feedback from employees. Not just that 20% of the remote population before who didn't have access to these benefits, but also from employees that were in the offices as well. You could imagine that there's probably a lot of people that didn't make it to that 12 o'clock yoga class because their meeting ran 5 minutes long. So now they have a new opportunity to be able to take advantage of these benefits in a more flexible manner. And so this is just one example of an employer who had some key learnings in 2020. And these key learnings are actually benefiting their culture and their community. Two things that this employer has worked very, very hard over the years to build. So continuing on with some examples and learnings, we have a team story of professional resilience. And so this is actually a spoiler alert, this is my team. And as a team of very busy professionals that are typically traveling around, working strategically with employers, driving engagement at health and benefits fairs and more, you can imagine this year has looked quite a bit different from us. And we've had a lot of learnings. Some key learnings that we've had is that virtual health and benefits fairs can actually be just as successful as in-person events. There are a lot of vendor partners out there that you can partner with to be able to run a health and benefits fair successfully, and you might actually find that you have more engagement. This engagement can come from more flexible times being offered for your population, as well as the ability to add in family members that otherwise couldn't attend in person. And so this is something that we learned this year as we waded through 2020. We've also needed to adapt our promotion materials to include more materials that specifically focus on 2020 topics, such as social distancing or staying productive and other topics like that. And we also discovered, as you can see here with some of these examples, that infographics are a really great way and a refreshing, different way to be able to communicate with our employers and with their members as well. And so I encourage you, if you're looking for something fresh and new, we've gotten a lot of great feedback on that. In addition, communication modalities. I'm sure you all have been there as well. We've needed to make some changes in how we communicate to our members and our employees to be able to reach the most of them and get the most engagement. And so this year, we focused more on electronic communications and direct mails to hit individuals at home. Then we have workplace signage, posters, or even electronic messages that go across boards. And so those are just a few things that my team has really glommed onto this year as learnings. And then for me personally, I discovered that it's okay that what I planned for in 2019 for 2020 didn't happen. Our goals and objectives as a team didn't change, but the tools, the way with which we went about actually achieving them really did need to change, and that's okay. And I'm sure each and every one of you have had that experience, whether it's professionally, personally, financially, and more this year. All right, so in closing today, COVID-19 has been hard on all of us. 2020 has been hard on all of us. Hopefully, though, it's brought some new learnings and some different ways to be able to show us how flexible and how resilient we actually can be. And so I really do encourage you, take a couple minutes today. Think about your experiences in 2020 and all that you personally, as a team and organizationally, have had to overcome. Be sure to capture those stories and make sure to share them with your colleagues, because it can be very positive to start to hear some of this type of spin when you think about all that you've learned in 2020. And so for resilience, I chose this quote. I feel like it's a great one from Tony Robbins. Stay committed to your decisions and your objectives, but stay flexible in your approach. That's something that we really needed to do this year, and hopefully we can continue to do. Resiliency it's like a muscle. It's a muscle for uncertainty. And the more we practice it, the more we use it, the more we condition that muscle, it's really going to serve us well in the long run in life in general. And so thank you so much for your time today. And now I'm really excited to hand it over to one of my colleagues, Jeff Fitzpatrick, to talk about employee well-being, value on investment. Thank you.
Thank you, Megan. So now we're going to transition to Jeff as our next speaker, who also specializes in providing well-being programs to employers. In this section, he'll cover how to evaluate the value of your well-being programs as drivers of better health outcomes. Jeff Fitzpatrick is head of product for Cambia Hill's Human Performance Division. He currently leads a dedicated product management team as he drives strategy, delivery, and engagement for Cambia's portfolio of well-being solutions. His education and background are in exercise science and digital product development. Jeff has served in the health and well-being industry field for over 13 years. So now I'll hand it over to you, Jeff.
Thank you, Reagan. Appreciate that. Great. So I'm super excited to be here. I'm excited to present on this very popular topic. This is something that we in the well-being space we face a lot, and it's the old question of ROI versus VOI when thinking about well-being. So is it your return on investment, or is it the value on investment that you should be focused on when you look at a well-being solution? Typically, it has been ROI in the past. But what we're realizing now, and especially as of late, that not all aspects of your well-being can be tied to the dollar. There are many other aspects that are more holistic in terms of your overall employee workforce well-being. But traditionally, there are some interesting ways of looking at well-being, and I'm sure that most of you are aware of these. But traditionally, things such as saving on healthcare costs and monetizing claims savings. So very much so. A lot of our clients want to drive down their claims costs. Completely understandable. It's a very large expense. So that's one of the main reasons, traditionally, that well-being solutions have been sought after. Another reason is that oftentimes well-being solutions are a part of the greater employee benefit selection. And this is important when it comes down to aspects such as retention and recruiting. It's important to have a well-being solution so that when you go out to hire those important people, that they see that you have the solution that they're after. And then finally, one of the things that you'll often remember or you'll notice is well-being solutions are typically a part of another product package. Organizations will sometimes buy insurance, and there may be a buy-up opportunity, and they will buy the well-being solution in that manner. So that, again, these are more of your traditional rationale for why an organization might consider a well-being solution. But because things have changed And we're acknowledging that, again, not every aspect of well-being can be tied to the dollar. There's alternative ways of looking at it, and there's alternative rationale for supporting why you should consider well-being solutions for your population. So some of the things to think about are keeping productivity high and eliminating as many as you can sick days. And there's a slide here in a moment that I'm going to talk about that discusses the impact of sick days. It also talks about the impact of employee wellness and how it impacts productivity. And then we also are going to share more about increased morale. So morale is one of those very elusive things to measure, but has a huge impact on your employees' well-being, which at the end of the day will affect your bottom line. And then finally, what we're also learning now, especially with the newer generations, that we as employers are looked at very closely, and what we have to offer very much affects our recruitment and our retention. And so you'll see different aspects of that appear here in a moment. So why should HR professionals and employers care about VOI? It's kind of what I alluded to. It's because physical, mental, and emotional health are intertwined and tied to performance. So now more than ever, employees want and need this support. So what are the components of VOI? What are the components, more of the intangible components that you should think about? Much like what's in the graphic on the right, several different aspects of these programs should be considered. For example, retention, big deal, right? So that's a huge expense for organizations, getting and finding the right talent and keeping them on board. Productivity is another one. Referral rates, that's another one. Work satisfaction. Do you know how satisfied your employees are with their work? Is this something that they're getting a lot out of? Are they bringing their best every day? What about engagement? Are your employees, are they surrounded by and are they engaged in your culture? Is it something that they care about? Maybe they talk about. That's really important to make sure you get the best out of them. And then morale, like I mentioned, a lot of aspects here that are somewhat intangible and difficult to measure, but are extremely important when looking at the value of investment. So here's a couple of examples, and we'll share these out. As you can see, there's references here on the bottom of how these aspects can indeed affect the bottom line. For example, this first one pertains to retention. Or every time a business replaces a salary employee, it costs 6 to 9 months of salary on average. So that's one employee. Think about that across an annual a number of employees leaving. That could have some significant impacts to the bottom line. This next one has to do with illness as it relates to productivity. So decreased productivity due to illness costs the American economy over $264 billion annually. Now that's a big number, right? And so if we can help reduce illness by capturing and leveraging the appropriate well-being solution, we'll see productivity improve, which by the end of the day will affect the bottom line. And then finally, lost work days due to stress and illness. Over $30 billion annually in this country is due to stress and illness. So if we could help capture and maintain the happiness of our employee base, we stand to, as a U.S. Employer economy, to save over $2 billion. So some pretty significant impacts from a VOI perspective of a well-being solution. So if you like what you're hearing and you're thinking, wow, that sounds interesting, well, how do we measure it? And that's a super good question. It's one that we get often. And so we, even in my organization, we've tried a couple different methods that work pretty well. And so some of them on screen here that you'll notice that work, that you might want to consider are engagement surveys, really informal surveys that you send out to your workforce, asking them how, are they engaged with their work? Are they getting fulfillment out of it? If not, then what could be changed? These are super powerful surveys to send out. Also, the benefit and intervention usage. So the benefits that you put out and provide to your employee base, you might want to think, are these being used? Are these the right benefits for my employee base? Take a look at those. Take a look at those numbers and see if they're being utilized, or see if you might need to adjust. Also, another really nice way to see if what you're offering offers value, you might want to bring in people that are maybe on their way out or on their way into your organization. So onboarding interviews, exit interviews, really nice times to ask people the hard questions and ask them what they're looking for, or do they see value in some of the things that they were getting. Customer service statistics, great, right? So if you have those statistics within your organization and you can bring those to the service and share those, great learning opportunities there. And then cultural buy-in surveys. I know that my organization does a very good job actually of sending out these cultural buy-in surveys, and it really gets to the heart of, you know, are you getting the fulfillment? Are you showing up ready to work? And are you buying into the vision that the overall organization has? So really nice ways to measure VOI. So we talked about what VOI is and why it's important, maybe more so than ROI. We talked about the different aspects of VOI, and we even talked about how to measure it, but how do you get started, right? These are really important questions for some of the HR professionals. And so what I would say is, if someone asked me that, I would say, well, prioritize what matters most to you. What's the most important in your organization? And if you look on your vision, you read through, you know, what you stand for as an organization, the answer should be right there. Make sure that you look at the style of the well-being program that you have. Make sure that the emphasis is put where you want it to be. Is your emphasis to drive down claims like we talked about before, which is kind of a more traditional aspect, right? Is your emphasis to improve morale? Or what about decrease absenteeism? Because an employee that's away isn't going to be as productive. So maybe you want to focus on that. Or maybe it's just on productivity at the end of the day. Or do you want to retain your workforce? Have you had a lot of churn? And have you spending a lot of time and energy keeping your workforce? I'm sure your answer is all of those, but what I'm trying to get at right here with this final slide is to encourage you to really take a look at your organization and your culture and make sure that the well-being solution that you're using really ties in closely to that, and it really focuses on the priorities. So hopefully you've got something out of this. Remember VOI, and thanks for your time. I appreciate it.
Thank you, Jeff. And if you'd like to learn more, we have a November CE webinar that will focus entirely on calculating the VOI of your well-being programs. Moving on to our next topic, healthcare costs, specifically your pharmacy spend, one of the areas with the highest potential for health plan savings. So again, I'm Reagan Corliss, and I've worked in healthcare benefits for over the last 8 years, focusing on building helpful content and educational webinars for human resources executives. Now I'm doing the same type of content work with MedSavvy. And MedSavvy is a unique and innovative online medication management service that helps employers and employees save on medication costs while improving their health and therefore productivity. So real quick, to provide some context on MedSavvy, before I start getting into the employer user stories and employee case studies, MedSavvy has been serving employers and their employees for over 3 years now. Consequently, we have new results and data that are beneficial to learn from. The process has involved engaging employee groups to use MedSavvy to help save on their medications, while also receiving convenient online access to pharmacists who provide online consultations, and graded medications for transparent side-by-side comparisons, including prices that represent their out-of-pocket costs adjusted to their health plan and location. The side-by-side medication comparisons include cost, quality, and side effects. Let's start with how employees are benefiting from convenient virtual pharmacist assistance and online medication guidance. In the next slides, we'll review some real-life examples demonstrating how employees are benefiting from convenient virtual pharmacist assistance and online medication guidance. So what we're seeing lately with online pharmacist consultations is that users are saving on doctor visits in many cases, while other members are being encouraged to visit their doctors when it's important to involve them. We're also seeing that frequently the wrong mix of supplements mixed with meds is being missed by physicians, and we are catching these through these consultations. Common requests lately coming from users have included online pharmacist consultations, virtual medicine cabinet checks, review of specific medications, help me save requests, and lastly, responses to safety switch and savings alerts in which the users are asking for additional assistance from the pharmacist. And then in regards to COVID lately, the pharmacist consultations have been frequently covering issues, including insomnia, anxiety, depression, as you would imagine, inhaler costs, virtual help with obtaining refills and new prescriptions, among the other key costly conditions such as diabetes, heart disease, ADHD, and hormone therapy. And as previously mentioned, saving trips to the doctor and pharmacy have been key during these COVID times, as well as easing the access to care when it's needed. Additionally, customized engagement marketing programs adapted to unique employee populations coupled with quarterly reporting have been key in the employer case studies I'm about to share with you. Part of the quarterly reports include summarizing the employee population's top costliest conditions in terms of medication costs, which vary by population, but also the top conditions with the most potential for savings. This helps direct the engagement communications to the employee group and can become the focus for personalized care campaigns. So let's move on to employer user studies. In regards to online pharmacist consultations, we have many great user stories during COVID times. Here is a sampling of recent results from online pharmacist consultations. The pharmacist team consulted an employee on mixing antihistamine meds with other prescriptions, saving him a trip to the doctor. They also helped a concerned employee regarding the flu vaccine, reassuring her to get her flu vaccine this year. They identified insomnia symptoms potentially caused by a user's medication at no extra cost, and possibly saving them an additional doctor's visit. Additionally, they recently found a severely depressed man who was inadvertently taking a prescription known to make depression worse. And lastly, a user found significant savings on diabetes medication and advice on mixing with other meds. The virtual medicine cabinet helps keep track of medications, and users can even have a pharmacist review them for interactions, safety concerns, and cost-saving opportunities. In this case, the pharmacist caught a virtual medication issue. The employee submitted a medicine cabinet check for her grandmother. The deck revealed her grandmother was taking 3 different meds to treat the same condition. One of her meds could cause low blood pressure, even leading to lightheadedness and falls. And this explained her grandmother's recent ER visits. This example was provided to us in a testimonial, and she said, "I really like that it's not just for myself. I can use it for my family members too." The pharmacist team also sends out medication alerts based on meds loaded into the individual medicine cabinets. In this case, this safety alert was the only notification about a user's son's life-saving EpiPen recall. Her son suffers from idiopathic responses to numerous allergens, in other words, unexpected and potentially deadly reactions to many things. The pharmacist also identified the medication most likely to be responsible for his bothersome reported side effects. Additionally, the pharmacist provided alternatives to the medication and recommended he make an appointment with his doctor to discuss options. In regards to recent help me save on my medication requests from users, we have many user stories, and I've just highlighted a few of the recent ones here. More details on these user stories are posted on the MedSavvy blog. Visit us at our booth, and we're happy to provide a link to these full user stories. One user saved more than $250 per month on ADHD medication, while another user saved $230 a month on depression and anti-anxiety medication. Alternatives for COPD, chronic obstructive pulmonary disease, saved a health plan more than $1,000 per 90-day supply. And a user searching for an alternative medicine inhaler, Symbicort, saved $70 a month. Lastly, a family with a 10-month-old daughter who had GERD saved more than $200. So let's move on to employer case studies. Here we have an ROI success story based around a medical group. This employer is physician-owned multi-specialty medical practice located in Idaho. They have over 50 providers, including physicians, nurse practitioners, and physician assistants. In our success stories, we'd like to give you an idea of demographics and culture in order to help understand the variables that led to their success, or maybe they had problems. In this particular case, they had 183 employees, which is 381 when we add in the dependents. They also have a PBM, which is Prime Therapeutics. And a key component is their culture. This particular culture is very strong in wellness engagement, and they have an encouraging management team, plus a culture of cost saving. Clinic and hospital staff includes doctors, nurses, maintenance, and administrative staff, and they have a wide range of education and skills. Their challenges? Well, the management's primary goal was to lower their healthcare costs and build a culture of cost savings with their employees while still maintaining their strong culture of health. It's always interesting to look at how the employee ages range within an employer group as well. So here we see that our wide majority of them are female, and the medium age is also the most frequent age, and that's 41 to 50, and then 51 to 60 is the next highest age range. So with this particular employer, they exceeded their goal with a 5-to-1 ROI. What it boils down to is this employer's average savings per registered user per year who took action to save by stopping, shopping, and starting and switching medications resulted in 1,091 average savings. These savings are shared between the employer and employee depending on the benefit design and deductible phase. This is where the company culture and leadership are key players in the success of the program. They had 84% registered employees, which is phenomenal. Also, 29% of those registered employees actually took action, leading to an annual savings of $57,000 a year. Here's another healthcare organization. This employer is located in multiple states with several divisions. It includes a family of companies ranging from software and mobile applications, healthcare marketplaces, non-traditional healthcare delivery models, plus health and life insurance, pharmacy benefit management, wellness, and overall consumer engagement. This particular employer has more employers at 4,800, and including dependents, that's a little over 10,000. They also work with Prime Therapeutics. They're also, the majority of the population is female. In regards to their culture, they are health-centric, and they have high wellness engagement, they're tech-savvy, they're customer-focused, and they're primarily white-collar. So the average savings per registered user that was achieved for this employer came out to be $650 average savings. And that's per year for those who took action to save by stopping, shopping, starting, and switching medications. Other interesting components is that 34% of them were actually registered with MedSavvy service, and 21% of those employees took action, which boiled down to 1,633 employees, and that led to an annual savings of almost $216,000. So thank you for taking the time to learn more about how to save on your pharmacy costs. I'm going to put in a real quick overview of MedSavvy on a slide at the end of this presentation. So lastly, the third key area we're going to cover is new ways for employees to experience healthcare and empowering them to take advantage of the benefits you're offering. Our featured presenter for this section is Kristen Walton, and she is the Senior Business Development Executive at Journey. Kristen joined Journey after working in insurance brokerage, human performance and well-being, medical educational publishing, and nonprofit businesses for over 20 years. Kristen is focused on collaborative sales relationships to bring innovative consumer-centered products to market, and she now focuses on Journey. So to give you a little bit of context about Journey and where Kristen is coming from, Journey is an innovative, integrated healthcare solutions platform that helps employees organize and manage their family's healthcare all in one place. Key features include combining data-driven intelligence and providing virtual assistance to employees in navigating through their healthcare benefits, encompassing live chat 24/7, ask a nurse, health coach or pharmacist, help with billing and treatment estimates, personalized well-being insights, and more. So now I'm going to turn it over to you, Kristen.
Thank you, Reagan. Hello, everyone. First, thanks for spending a little time with me today to talk about the new world of healthcare and how to transform healthcare and benefits experience for your employees. Let's start by looking at some of the trends and challenges that employees are facing as it relates to their healthcare and benefits. We know that each year, the average spend of healthcare increases, and you can see from the data here that this increase has been significant in the past year. And while employees are investing a lot in benefit offerings, despite the need, employees often don't use these benefits. So solutions really need to provide not only convenient, but meaningful engagement. And then looking at it from the employee perspective, surveys have shown many employees do not understand their benefits, and paying medical bills is a struggle and a huge source of stress. Let's face it, 2020 has been a really tough year for all of us. And at this unprecedented time in history, both employer and employee challenges are truly at an all-time high. And that said, taking a stat from Catherine's earlier presentation, during these unprecedented times, there's an overwhelming majority of employers that are still placing a really high priority on focusing on employee benefits and health. And this really speaks to the need right now, in particular, for solutions and services to support employers and their employees to better navigate their healthcare and benefits. So let's take a look at this new world that employees are facing around their healthcare and benefits. And if we take a moment to think about it, in the past decade, the healthcare experience for employees has changed dramatically. Historically, employees did not have a choice over their benefits, their benefit plan. Health plans were very rich with little financial burden on the employee, so little financial responsibility on the employee and around healthcare. Additionally, provider options were limited, and these limited providers also had most of the control over healthcare decisions. So today, with the introduction of many different health plan options, HSAs, ASEA providers, choices in network and navigation, now more than ever, employees have more choice, better access, and increased convenience and control over their healthcare. And this is a really good thing. Of course, the new world of choice, access, and convenience and control is a good thing. But with all of these advantages comes a lot more responsibility placed on the employee and as a consumer of their healthcare. Navigating healthcare is now required for the healthcare consumer, and it's complex and confusing. So what's the result of this complexity and confusion? First, if we look at inaction, often employees, for lack of understanding and time to navigate their benefits or fear of costs, avoid seeking care until they absolutely need it. And this leads to rushed, uninformed decisions that can be costly from both a clinical and a financial perspective. Both inaction and uninformed decisions lead to poor outcomes and coordination of care, which are expensive to both the employee and the employer plan, and most importantly, expensive to the well-being of the employee. This in turn results in reduced productivity, absenteeism, reduced engagement, and reduced presenteeism. And finally, the complexity of healthcare navigation exacerbates the inequities in access to care related to social determinants of health. So what do employees need to support them in this new world of healthcare consumerism? As we know, employees live a mobile lifestyle at work and in their personal lives. In their daily lives, they rely on mobile-enabled solutions that allow them to navigate through their day right from the palm of their hand. In the new world of healthcare consumerism, employees need this ability to navigate their healthcare and benefits like they do the rest of their daily tasks from the palm of their hand. They need self-service digital solutions, but digital solutions alone are not enough. Solutions that will really create a new experience for the healthcare consumer will combine both digital and self-service tools, as well as wrap them in the support of the human touch. And these solutions really need to meet employees at their moment of need. A key component to meeting consumers at their moment of need is concierge services. A health and benefits concierge provides healthcare advocacy around benefits education, treatment cost estimations, billing assistance. This traditional advocacy model has been around the market for some time, But what really makes the difference for consumers is going beyond advocacy and offering a true concierge level service that elevates advocacy to managing all aspects of healthcare logistics. Things like provider and treatment research, appointment scheduling, pre-authorization, and medical record transfer management, and even assisting with transportation needs around healthcare. Traditional advocacy that's elevated is true concierge service. Employees also need digital tools to support and help them understand and navigate their benefits, not only for themselves, but for their families too. Family management is a huge part of the new world of healthcare consumerism, and tools that miss out on focusing on the members and dependents as well only partially affect outcomes and cost savings opportunities. As we know, the financial side of healthcare has become increasingly a burden for employees. With employees having more skin in the game with their healthcare decisions and finances, they need to have tools and support that offers cost transparency and billing education and assistance. Employees also need convenient real-time access to nurses, telemedicine, and pharmacists and health coaches when and where they need them. And finally, they need information that's specifically meaningful to them. Technology like claims-triggered push notifications to provide them with personalized recommendations around their actual claims experience engage consumers in a whole new way, and it makes all the difference in improving outcomes. Using technology for personalization in healthcare is key to increased engagement and improved overall well-being. As we learned earlier, COVID has only accelerated the desire and demand of healthcare consumers for digital tools and healthcare navigation support. So these are all great things, but how does this actually look for the employer and what value these services and solutions bring? So I want you to just take a moment and imagine Jennifer as one of your employees, or you might even imagine her as yourself. Between her responsibilities at work and her responsibilities at home, pretty much every second of her day is occupied. But Jennifer is particularly stressed because her daughter is struggling with anxiety, and Jennifer knows she needs to get her some help. How will she find the time to do this? And what does this look like for Jennifer to do this without support? Due to lack of time and being overwhelmed by benefits navigation, Jennifer could simply avoid making the appointment for her daughter. And what would this lead to? More stress for Jennifer and a potential escalation of her daughter's condition. Also, without support, the lack of information and time to research providers, she could book an out-of-network provider, which would be costly for her as well as the employer plan. Without cost transparency tools and support, she could spend more than she needs to on her daughter's medication. And finally, how could she find time for her own self-care? With the right support and digital tools, how could this experience really be transformed for Jennifer? Well, if she has access to concierge services when and where she needs them, Jennifer can quickly engage and get the support in understanding her benefits, assisting with researching and matching her daughter to an in-network provider that's right for her daughter, and even having a concierge schedule an appointment for her daughter. All of these things could take up precious time from Jennifer's day, but with the help of a concierge, Jennifer's productivity is not interrupted and she can get on with her busy day. Also, access to medication research tools and cost transparency information provide Jennifer with the information she needs to understand her options, but also take advantage of cost savings for an alternative prescription for her daughter. This not only results in cost savings for Jennifer, but also cost savings for the health plan, and more importantly, better outcomes for her daughter. And lastly, in addition to Jennifer tending to the healthcare needs of her daughter, access to health coaches and digital tools to help her address her own self-care will improve her well-being and support her to be a more focused, present, and engaged employee. So how is Journey supporting employees during COVID and beyond? Journey is an integrated healthcare solutions platform that has responded to employee and employer needs during COVID, but it was built to change their healthcare experience beyond. Journey helps employees manage and organize their family's healthcare all in one place and providing the care they need when they need it. Journey's all-in-one platform is guided by a data-driven intelligence that allows users to chat with a real person 24/7, interact with the COVID symptom decision tool that also is supported with access to care guides and nurses to navigate special needs during COVID. They can stay on top of their healthcare spending and bills, track family history and family healthcare history. They can access a nurse, a health coach, and a pharmacist. They can estimate treatment costs and research and manage medications. And finally, engage with personalized well-being insights. So Journey combines leading edge AI-powered technology with human care guide support to deliver an industry-leading portfolio of capabilities for consumers. In closing, the positives of this new world of healthcare consumerism are really powerful for employees, but these positives do come with increased responsibilities. So healthcare doesn't have to be an overwhelming experience. With the right tools and support, employees really will evolve as empowered consumers. And this empowerment will result in better outcomes, cost savings, and improved well-being. Employees that are supported to live their most healthy lives bring productivity to their jobs, leading to improved outcomes in the workplace as well. If you want to learn more, contact us to see how we can support your employees in this new world of healthcare consumerism. Thank you so much for your time today, and be well.
So what is MedSavvy? MedSavvy is an innovative online medication management system. It's a unique and innovative employee benefit that helps employers and employees save on medication costs while improving health and therefore productivity. MedSavvy provides employees with online access to medication costs, quality, and side effects in side-by-side comparisons. Our team of pharmacists provide online consultations and grades medications using a rigorous evidence-based system. MedSavvy integrates with employer existing pharmacy benefit plans as well, and the costs are customized to employee health plan and location. So there's a real quick overview of MedSavvy. Please stop by our booth and we'll be happy to tell you more and provide you with additional information. So in closing, please join our email list at the link below this video to receive additional updates on upcoming CE webinars and helpful content. If you would like to request additional information, product demos, or leave a comment, again, contact us at the link below this video. And also, you're welcome to contact us directly at this particular email, sales@medsavvy.com, and this phone number. Thanks again for your interest.